and that is our biggest industry. And those farms are multi-million-dollar industries, and people should be aware of that. These are real people, real businesses who have huge investments in their land and their equipment, and they're a big part of who we serve. And I just, before I address the health piece, I just wanted to mention that there were a couple of really good questions that kind of were directed to rural. And one of them was about the Brain Fuse program, so they could submit their resumes. You know, we do not have a subscription to Brain Fuse, but we do have a really good relationship with our local workforce center, which is actually 20 miles from where we live. But we do know that they provide that same service for free. They'll read people's resumes and then give them back with corrections and updates and improvements. So we've really worked on that. And then the question about access, I think it really in the state of Minnesota, regardless if it's rural or metro, I think whether or not you have high internet access, depends on who your service provider is. We are served by a rural co-op, telephone co-op, who is invested in their community, either their families, their kids, their businesses. So we are served really well. A lot of these co-ops have been putting fiber in the ground before it became popular. So when you look at the broadband map, you look at our little corner, we have fiber to the home. My friends who live in Norcross have fiber to the home. Norcross has 52 people, I believe. So, so we do have access. You know, we are keeping up. To address the healthcare issue, one of the things that we realized in doing our research and with our grant application is that there are social determinants of health that most of us don't have control over, such as where you live, where you're born, what you have access to. Do you have access to fresh fruits and vegetables? If you live in certain rural or very urban areas, the answer may be no. So I may have access at my local supermarket, but another town in my county doesn't have a supermarket. They just have a convenience store. And if the senior citizens no longer drive, they're dependent on someone else to bring them access to those things. And obviously, I think broadband access ties into to health and wellness on many levels. But one, our local hospital, which, by the way, we're building a brand new hospital in Alva Lake, they use high-speed internet to communicate with other doctors and specialists and treat their patients. Obviously, that care in emergency situations is really imperative. And if you wanted to do some research on accessing a condition you have, you're going to maybe seek your library to look into that. And the other area that we focused on was statistically, we know that the more educated you are, usually you're going to make, and if we're just going to go statistically, I don't mean to insult anyone, but you're going to make better decisions about health and welfare and how you conduct your life, whether or not you smoke, binge drink, etc. That's just what statistics show. And those decisions you make are transferred to your children and their children, etc. And the more educated you are, the more likely you are to have a better job that maybe provides you with insurance. So, two components to